All right. Hello, everybody, and welcome to our very first roundtable discussion. I'm really excited to have you here. Today, we have two very special guests, and I'm going to let them take the stage and introduce themselves. First, we have Pete Moore. Pete, can you let our listeners know who you are and what you do?
Well, I'm going to be a gentleman and ask Barb to go first.
Oh, there you go.
I'm an English gentleman.
Sorry. I love it. Barb, hello.
Hi, I'm Barb Thornton. I'm a chronic pain warrior of about 20 plus years. I have worked with Deana for the last 2 years, part of the Change Pain Academy, sort of the co-creator of the Kutch community, which is our community specifically for chronic pain warriors. I'm a blogger. Yeah, a little bit of everything here, but definitely a mentor for chronic pain warriors, trying to show them there is a better way, a different way.
Awesome. Perfect. Great segue. Pete, hello.
Well, hi everyone. Listen, it's really cool to be connected with you guys today. Listen, my name is Pete Moore, and like Barb, I don't know. I'm not sure. Do I like the word warrior? I don't know. I'm someone that I've been living with persistent pain for quite a few years now. I won't go into my war story, but I was struggling with it back in the early 90s, 1990s, and I become like most people with pain, sort of a doctor shopper, stuff like that, therapy shopper, and looking for someone to fix my pain. And what turned things around for me was getting myself on a pain management program in London called Input. And what that program gave me was not only the tools and skills, but it gave me the confidence to manage my pain myself. And since '97, I've not had to take any pain medication. So, but that's all down to the program, really. And I sort of got into. I thought myself, I'm really digging this, like, the pain management stuff. And at the time, I was running a back pain support group, and I was trying to get the people on the support group to, to go on a program. It was really tough anyway. So I don't know what it was. I started to write my own program, like mini pain management program, and so it's generally for back pain. But anyway, but that was sort of the catalyst. And then a few years later on, then this came along, the Pain Toolkit. It's a little booklet I put together because I called it a Pain Toolkit because back before all this stuff, I was a paint and decorator and a drive instructor, and both nothing to do with pain, managing pain or whatever. But I just thought, when I was painting people's houses and whatever, I needed a toolkit, scrapers, filling knives, and different stuff like that. And I thought people with long-term pain, persistent pain, we need a toolkit of skills. So I started putting them together, and then I put this little booklet together. There's been, I don't know how many versions are. I think well, there aren't any hard copies anymore now, but there's loads of different versions and different languages. But anyway, so I've been working on that now since 2001.
Wow.
And so I run workshops for people with pain, and also healthcare professionals because they struggle as well. And also there's a VR version of where people can go, but you don't have to use a headset, but you can go and visit the Pain Toolkit that way and meet up there. And also there's from this year there's like an AIP where people can go to. They can ask me questions about myself, pain management, and the Pain Toolkit. So excellent. I know I've gone on too long, but
no, this is so interesting. It's awesome, and people need to hear this. So
there's a lot going on.
A lot going on.
It's privileged to be here today with you guys. It's very privileged. So thank you.
Oh, no, thank you guys. We've been talking about this for a while, so I'm really excited this can happen. My name is Deana, for those who might not know. Deana Tsiapalis, the crazy last Greek name. I live with intermittent pain, so I don't live with it every day, but I am a chronic migraine gal, have been for a very, very long time. But I do find as I age, that starts to shift a little bit, and the more I learn about pain, obviously, the better it is. So I am a chronic pain coach, podcaster, YouTube channel, and same like Pete, I'm just trying to bring to the world the whole idea of self-care management. That's what I've always done. I've always been in the wellness industry. So to see the gap that needs to be filled within the chronic pain community is definitely why we're all here today, because there's just so much to talk about. I am the founder of the Change Pain Academy, where we actually have a two-tiered approach, one where we talk more about just sort of the nervous system and getting the nervous system to a state that can actually do the work to move beyond. And then we have the second level, which is where we do a little bit more of the deeper dive into all the other skill sets. But more importantly, I'm really here to be here with you guys to have this conversation. So what we are diving into today is kind of two things we've talked about over the last couple of months as a group of three here. We have landed on the idea that we want to talk a little bit about words, because words matter. And some of the words we're going to talk about today are some things that might be potential hot buttons for the chronic pain community. And then we're going to sort of switch into talking a little bit more about, and this is a big one, why do we get stuck? Why do humans who live with pain get stuck? And so, it's free for all. Anybody wants to chime in at any time, please feel free. But let's put it out there. I guess the first question would be, if we were to look at pain sort of in the biological, the psychological, and the social aspect of pain, because it always is those three, if we were to look at those three components, what would be the first thing that comes to your mind for either of you, as far as reasons why we get stuck? We're going to start with the stuck, if that's okay with you guys. Sorry.
Well, for me anyway, sorry, Barb, did you want to start?
No, go ahead, Pete. Go ahead.
We're going to be polite.
To me, that's an easy one.
Yeah.
Because it's what reason why we get stuck is because of something called the medical model. Because it's when we go and see a doctor for, say we've got, I don't know, an infection or something like that, we're going to be treated in some way, and after 10 days or so it will disappear. But when it comes to like a pain problem, they're still doing it the same way. So it's all about treating. So take this, Deana, take this here, and it hasn't improved. Come back and see me in 10 days' time. So what they normally do is give you pills, painkillers and whatnot, and thinking that, well, this painkiller will go in there and sort out, mend everything and stuff like that. But when you've got long-term pain, it's that medical model is as much use as having a third eyebrow. It's just taking it's just a waste of time, because when you've got long-term pain, persistent pain, as I call it, other factors. When people have had pain for longer than 3 months, other factors kick in, like sleep problems, money worries, partners, problems, work and stuff like that. Weight gain or loss, losing their fitness and stuff like that. Right. So pain naturally then ceases to become the bigger problem, the main problem. All this other stuff creeps in and overtakes that. It's a slide I used, with an iceberg. With an iceberg, you see like a third of it. And it's the same thing with pain. Pain becomes only the tip of the iceberg because all this other stuff we've got to start dealing with. So any pills or treatments you're going to get it's going to be a waste of time. But the thing is, that's what in most medical schools now, whether they're learning to be a doctor or physio or some other healthcare skill, they're basically still use the medical model for pain. And as I say, it's not that useful really. So all it really does, it takes what I always say, takes us out the driving seat and puts us in a passenger seat. Obviously, it's like learning to drive. When you're learning to drive, you're sitting in the driving seat because you're learning, Yeah. But because when we're in a passenger seat, I call it become health tourists, So we start, as I did, visit X-ray department, MRI department, physiotherapy, OTs, and whatnot. So we do this big tour around the health system, and that's why I become health tourists. So to me, until the medical schools include the self-management model of care,
Right.
which is all about partnership working between the healthcare professional, like
Right.
yourself, like a coach, like me as a coach, and Barb.
Mm-hmm.
When self-management, it's not about we've got to do it all on our own.
Right.
It's a partnership partnership deal.
Yeah.
And then really like most people, like who come on our courses, your courses, our workshops and whatnot, is that they then get on with their life, and in spite of pain, there's we all have, we're living with pain, all the three of us, but we've got on and doing, we got on and done stuff.
Right.
The fact that we've hung back a bit, and we're like traffic cops, really,
Yeah.
just, showing people where to go, etc., what to do.
Yeah.
Yeah, so until they include a self-management model of care,
Yeah.
excuse me, in their curriculums, people with pain, mate, we're pretty screwed,
Mm.
So,
Yeah. Barb's nodding. Yeah.
Yes, Barb's nodding for sure.
Yes. So Barb, your thoughts?
I totally agree with Pete. I think all of us were brought up in the doctor said model,
Mm-hmm.
and what doctors say is not always helpful. So things like there's nothing more we can do sets people back on the couch.
Right.
It's not in any way encouraging, and it's not showing anyone that there is more that they can do.
Mm-hmm.
I think the other thing too is, and I've noticed this with some of the people I've been working with, people seek a diagnosis. Some of them get a diagnosis. And once they've got a diagnosis, they focus their energy on that specific diagnosis.
Right.
What they fail to realize, and what doctors fail to realize, is the common thread between multiple diagnoses is pain.
Right.
So you can research MS or any of the, the big ones all you want, but that does not teach you anything that's helpful with pain.
Right.
It tells you there will be pain.
Mm-hmm.
It tells you there will be progressive pain, but it doesn't give you any skills to help manage that pain. It's self-defeating.
Yes. Right.
So I think that's a big reason as well that people get stuck.
Yeah, absolutely. So I love that we've started with the medical model, because it is a bit of an uphill battle for the community, as well as any providers who are not part of the medical model necessarily, or who are, but are sort of a subset, like physiotherapists, occupational therapists, that kind of idea.
And I think it's just blindly accepting the doctor says is one of the biggest mistakes patients make.
Right.
Because doctors don't know everything.
Right. And I think that's a good point, Barb, is that, we need to be able to, and Pete's saying the same thing, that self-care management really means getting out, seeking, what is it that you can do for yourself? Not what can be done to you, but what you can do for you is really important. And definitely one of the reasons we're getting stuck, because if you don't believe there is more than what your doctor is telling you, you go nowhere further. So yes, absolutely. And I was going through a bunch of reasons today, just kind of brainstorming all the reasons why someone might get stuck. And of course, it all comes back to what pain is, which is, if we think about being stuck and all the things that could lead to it, it really describes pain perfectly, from the overwhelm to fear, to anxiety, right? To feeling safe in your body, to lack of purpose, all those things truly lead a human to feeling like they're genuinely stuck.
It's just the same thing with thing is we're that don't just happen with pain, like I mean I've in the past I've worked with people with long-term conditions, and they get the same deal as we do, really, like where it's all medical focus. Listen, I'm not really I'm not against the medical model, because it's fantastic if you've got a busted broken leg or a dodgy something broken, something perhaps you've got to have an operation and stuff like that. I mean it's, but for long-term stuff, long-term health issues, self-management really needs to be incorporated within any treatments or procedures and stuff like that,
Yeah, it's true. And I think that's where our role comes in. So if we could work together, where they are really good at the acute care, really, really good. They're there to sort of rule out any red flags so that we can address, because oftentimes people are living with both. That's right. So I think, we're looking for that collaboration. Absolutely. I think that's important.
I'm going to ask you guys a question. What's frightening about us? Because what is it? What is it about self-management that healthcare professionals struggle with? Because I got on social media, and I follow healthcare professionals, and they're so tuned into their, like especially the pain stuff. They're so tuned into just talking about pain. There's a bigger picture is like people's lives.
Yeah.
They seem to focus that if I can get rid of it, sort this pain out, then everything else will fall back into place, and it don't and it's but there seems to be I'm going to ask you, healthcare professionals watching this, what is your problem? What's holding you back? What's your kryptonite?
Right.
What's your kryptonite working with people like myself, Barb and Deana, and other self-management coaches, what's your kryptonite through not wanting to learn more about self-management? Keep getting your patients back in the driving seat. Because I'm always interested in what's holding you back, because self-management ain't rocket science. Because when you explain it to people, they go, as I did when I was on a pain management program. They was explaining pacing. I'm sitting there going, well, that's common sense. Why am I not doing that?
Yeah.
Yeah.
Barb, I'm pretty sure you have some things to share.
What the resistance is, you mean, from the medical community?
Yeah.
Well, the first thing that came to mind is a little bit smart ass, but it's not billable. If we can manage our pain ourselves, we don't need them the same way we need them now. That's probably true for some medical professionals, not all. But I do find that I now have a physician who's considerably younger, and I made him aware right from the get-go that this is what I did. And he treats me completely differently than any doctor I've ever encountered.
Right.
And he is so encouraging, and he's curious. So I think there is a glimmer of hope that this will eventually, but there's a lot of people suffering right now. We need it now, not 10 years from now.
Yeah. And I do see one of the challenges too is timing. I know it's always been this way, but I think now coming out of the pandemic, there's the industry, the frontline physicians, nurses are just spent. And to spend the time, to really get to know their person so that they can do person-centered care is extremely difficult. And the system's really not set up for that, right? They don't allow for the time, nor are they necessarily teaching doctors. However, just like you said, Barb, I do believe there is a shift happening. I really believe that, pain management is becoming, or pain education is becoming much more common. However, again, time and effort they don't necessarily have. So,
and there's pain education, and then there's pain education. As someone who went through a pain management course in 3 years ago, it was the most painful 10 weeks I've ever encountered. Part of it was because I had learned from you and from your program. It's very old knowledge they're teaching in a lot of these courses. So it's getting them up to date. And they don't believe we have the credentials to be teaching them a new way. And that's a stumbling block too. I think it's like, oh yeah, you're just a patient. You're
Mm,
just a patient. You're not a medical professional.
right.
So I think it's maybe credibility. They don't trust credibility of
Yeah.
patients.
Yeah, that's true. So
And
go ahead,
yet,
keep.
and yet,
Mhm.
if someone went to come to them with an addiction,
Mm,
say like the most common one, a drinking problem,
mm,
you know, and there's probably, people say they have to tell themselves they're an alcoholic.
mm.
But if someone went to come to the surgery and said, "Oh, doctor, I think I've got a drinking problem," whereabouts would they send them? They would send them to an organisation probably called AA, Alcoholics Anonymous.
Mhm.
Exactly.
Guess who runs that?
Yeah. Yeah.
And how many doctors are involved in AA? Zero.
Right. Ah,
Yeah.
great, great
And yet,
analogy.
can you see what I mean? So, what's so scary about us?
Yeah.
I mean, I think as long as we've got, I mean, personally, I mean, um, I've, when I worked in the NHS here, the National Health Service, I was a Stanford trained trainer.
Mhm.
But while I was there, I did a qualification. It's called the Sitting Guilds, which is a recognised national organisation for standards of teaching and stuff. So
Mm,
I did a Sitting Guilds certificate for teaching adults,
mhm.
and then I did one on Sitting Guilds for doing presentations,
Wow.
So in fact, I think we're more qualified. We could be. Perhaps we need to step up and do qualifications and stuff. I don't know, but
Mhm.
or self-management trainers, so that there isn't this resistance, that we're
Yeah.
Yeah.
well, yeah, just a patient. I ain't a patient anymore. I'm a person.
Yeah. Right.
You
Yeah.
know,
It's true. It's true.
I do still refer to me as the patient, but
Yeah.
I'd say to them, no, I'm not, mate. I'm a coach. You know.
Right. Right. Absolutely.
If you want to keep calling me a patient, I'll put my pajamas back on and jump back into bed.
Right.
Yep.
Yeah, absolutely. Well,
The
thank God
coaches, yeah.
we're moving on from that. Yeah, no, it's so true. I'm going to just pull us back a little bit because I think this is definitely an important topic around just the whole medical model. We could go on for hours about this, but since I promised we'd talk about getting stuck, let's now maybe start to explore some of the other things and reasons why people might be getting stuck. I'm going to kind of draw upon your personal experience here. So, Barb, when you were sort of at your lowest point as far as living life on the couch and whatnot, can you recall any things that you really felt held you there where you are, like really held you in that stuck in the muck state?
I didn't know where to go
Mm-hmm.
to change things.
Mm-hmm.
We're so ingrained in you go to the doctor.
Mm-hmm.
I didn't know there was another avenue.
All right.
Um, I had lost the love of my life,
Mm-hmm.
and I felt there was grief on top of pain.
Mm-hmm.
Um, and then there was this whole loss of personal satisfaction, purpose,
Right.
enjoyment. I hibernated
Yeah.
because I hurt,
Mm-hmm.
and I hurt physically and I hurt emotionally.
Mm-hmm.
And I had to get to the point that I was angry
Mm-hmm.
that I was spending my time in bed or on the couch. And that's what it took for me was anger and a doctor dropping some words that I'd never heard before.
Right.
That's what propelled me. But I can see how people continue to live the way I was living,
Mm.
um, because
Mm.
something's got to light a spark.
Yeah.
And I think our best avenue is figuring out how to light that spark of hope.
Right.
And I don't have the answer,
Mm.
um, but yeah, it's easy to get stuck.
Yeah.
And I didn't have a diagnosis at the time,
Right.
and I lived for that diagnosis. Like I wanted that diagnosis. And did it do me any good? No, it didn't change anything to get a diagnosis other than going down that rabbit hole of researching that condition
Right.
and ignoring all the other factors that played into it.
Right. Yeah. How about you, Pete?
My lowest point, I guess, was I always remember it. Was on the 31st December '94, where if you want to make a note, that's my birthday.
Oh.
And people, some buddies come around to take me out because it'd been New Year's night, my birthday.
Uh-huh.
I was in so much pain that day. If you had said to me, how much pain are you in between 1 and 10? I was in orbit. I was 1,000, you know.
All right.
And that night, I was getting pretty fed up with myself because I thought I can't go anywhere, like, you know.
Mm.
And I did consider ending my life, you know.
Yeah.
I think that was my lowest point.
Mm.
I did a little bit of stretching, it eased off, but the pain came back with a vengeance the next day. And when I didn't have any whiskers then, I just shave every day. And then when I was looking at myself in the mirror, really, you know, and then I sort of said to myself, I'm recognising the guy that's going to get me out of his stuff, like out of his crap, like, you know what I mean. And I think that was a turning point. It was really there where I felt I had to take more charge, and that's when one of the speakers for the back pain. So I've got a speaker in from Input. I didn't know nothing about the program. Someone told me about the program, and I got one of the speakers in, a lady called Amanda Williams, who was a clinical psychologist there at the time, and she talked to the group about, hey, you know, you can learning how to pace, like, so when you learn how to pace, you can do more throughout the day without increasing your pain.
Yeah.
That sounds about it. What? It sounds interesting. You know, how to do graded exercise. So it's not about doing 10 of these, 10 of them. It's all about starting off at a lower point and increasing gradually.
Exactly.
My ears was, you know, really flapping. I thought, this is for me, like, you know.
Yeah.
I think if it wasn't, I would still be like most people, you know, doctor shopping, really, you know, therapy shopping and looking for that fix. But and I think that most people I come into contact with, so the thing back then, it was like the early '90s, mid '90s, and it's a lot better. I know for a lot of people watching this or listening to this, thinking, "Boy, oh boy," you know, I've been like that. But believe it or not, it's where we are at the moment, where we're Captain Kirk stuff, you know.
Yeah.
The fact that we're having this conversation via Zoom.
Yeah.
I mean, back in the '90s, when I was running the support group, there was no email, didn't exist.
Right.
There was you want to contact someone, you write them a letter or pick up the phone, you know.
Yeah.
So doing this now, this is, you know, James T. Kirk stuff, you know.
Yeah.
But I mean, people are still getting stuck now, but they don't know which way to turn. And it's funny enough, I talked to Amanda Williams about this a couple of years ago when we met in London for coffee, and we talked about this, and she said, you know, the reason why people get stuck because they don't get a diagnosis, you know.
Right.
They're still, like, you know, you said, Barb, you know, they're fishing, you know, they're still looking, well, what, you know, and until they get a clear diagnosis, it's like they're still searching, sort of thing, like, you know. And it's just, as Barb pointed out, you know, the thing is with doctors, they don't all come out of the same jelly mold, you know, so there's going to be different, you know, they've got different personalities, different ways. You know, if you're really lucky, like with Barb's doctor is willing to be interested about self-management and stuff like that.
Yeah.
But as you said at the beginning, Deana, they're under, because of COVID and all that. I mean, we've got massive problems here in our NHS, and waiting list. I think it hit a million. Well, because we've got the strikes as well. You know, the doctors are going on strike because they haven't been given a pay rise in years. So, but at the moment, where on the TV it said the other night that 1 million people are waiting for the hospital appointment. Like, you know.
Yeah, no, it's true.
Yeah. So why don't they look to what can people do for themselves? You know.
Exactly. Yes.
And that's why I started. Yeah, I mean, I've got a Pain Toolkit site, but I then got my web dude to start up a self-management one.
Yeah.
Specifically, listen, when I worked in the in the NHS, we had to. They said that we need to find out, does this program work and how people are moving on and stuff like that. And what I did, I was a little bit cheeky. I actually added a couple of questions to the questionnaires I sent out, and it was, since going on the program, have you decreased seeing your GP or hospital less, and do you need so much pain, so much medication?
Mm.
And you know what? We did it for me. It was like a personal study of over 1,000 people,
Wow.
and there was a marked evidence.
Really?
My little area I was covering was Essex.
Yeah.
It's the county I live in. That there was a decrease in seeing a GP, unplanned A&E missions, or unplanned A&E visits, and reduction in medications. So it works, but you got to, we
don't have the data. Yeah, we need the data.
Yeah. I mean, so it does work, but is that bit of kryptonite somewhere in our own healthcare?
Yeah, no, it's true. Go ahead.
I think another couple more points. People, once they get that diagnosis again, people are open to joining a fibromyalgia support group,
right,
or a ankylosing spondylosis
yes,
support group.
Yeah.
But for some reason, they don't see that the common thread is pain, and they're not as open to joining a pain support group.
Right.
And I don't know why. I've noticed that. And the other thing too is, and I was guilty of this, very guilty, Deana, you know that, is there's a lot of buzzwords out there that apply and are very effective for pain, but they've been used in different contexts.
Yeah.
And people see them as woo-woo. Guilty. Meditation, mindfulness.
Yes.
People see that as new age, fad, woo-woo medicine.
Yeah.
And guilty, that, very guilty. But I was willing to try. I was willing to open my mind and try.
Yeah.
And many people just can't make that leap to open their mind and try.
Right. And again, yes, you hit the hot buttons there, which is great, because they have been hijacked, unfortunately. Even the word, recovery, healing, improvement, all these things, right, have been hijacked, which we'll definitely dive into. But I do agree 2000%. I forgot what I was going to say. That's my brain, but we're going to move on. But good points, Barb. Yeah, I really agree.
Could I just before we move on?
Yep.
The reason I think one of the support groups is that it's got how they're run, because a lot of healthcare professionals have said to me over the years they're reluctant to send people to support groups because they see them as like they go there and all people are doing moaning about their pain, but not learning how to deal with it. But it all comes down to the leaders, sort of thing. So I think people start up groups for good reasons, but if they're not, if there's not like an agenda,
yes.
I mean, Tom, I think Tom Bowen, he's down in the United States. He runs a Facebook group, but it's no whinging or moaning.
Yeah, that's right. No whining allowed.
No whining allowed. Right? So Tom's got the right idea, but unfortunately, there are support groups. People start them up, and they see it like empire building. I'm running a group, but the thing is, it's the group. The group runs the group,
right?
Not one person, sort of thing.
Right. The largest one in Facebook that I know of has thousands and thousands of followers. It's started up by a doctor who does not manage in any way, and it's all about. I mean, there is some good that comes from it in the sense that they have camaraderie, they have that connectivity, but it's all the downtrodden, tough stories, right?
I wouldn't join it.
Yeah.
I'm looking for solutions. So even now, if I can learn from someone to manage pain better, manage my health better, dig it, love it, bring it on.
Absolutely.
I'm looking for solutions. I know I've got enough problems already. I don't want to hear about other more problems.
That's right.
Stop. They were saying in it, stop living in a problem, start living in a solution.
Right. I love that.
Me too. I do believe that just like everything, we get really good at doing things that we do enough of, right? So when people are complaining and complaining and complaining, we get really good at that. And so, sorry, Barb, didn't mean to interrupt you there.
No, that's okay.
Okay. One thing I'm really fascinated by right now, and I just want to sort of drop it into the conversation is, because we three kind of understand a little bit more about the science of pain, if we can kind of start pulling that into the equation around self-care management, not to overwhelm, but just to sort of empower so that people understand where things are coming from. And one of the things I'm really latching onto right now is just understanding how our nervous system can get us stuck as well. And it's fascinating. If we're thinking about sort of the biological side to being stuck, as opposed to the psychological or social, the nervous system is really such a part of the pain process, right? And it is truly part of the nervous system is helping us or stopping us from moving forward because we get into a certain state, that fight or flight response. And with chronic pain, it's living in that state for a long time. And it's really hard to be logical, to be motivated, to find joy, to be creative, all that stuff. And so there's so much more to it. I only bring that to the table just because it's food for thought, right? There's more we can do beyond taking that pill.
I don't personally, really get into all that sort of stuff. It's only my choice, though.
Yeah.
Because it's it's like goes into the scientific world, and my brain ain't geared up for that. It's
and that's okay.
I just know, especially people with neuropathic pain. But I suppose really, I'm just tuned into self-management. Really, I know, but I know it comes back to that. People knowing what's going on. Like with neuropathic pain, like phantom limb pain, stuff like that, even if they've had a limb amputated, but so they've had their foot amputated, but they still feel like they got a foot,
right?
And I find that quite intriguing. But I get all sorts of pain now. They're not specific. Since I've had I was diagnosed with prostate cancer, then I've had other pains sort of whizzing around my body and whatnot, and. But I don't really, but nothing. I don't really take a lot of notice of them. Really, I was just thinking, it's like someone. Oh, I don't like doing that. It's like someone moaning.
Yeah.
I'd like to say, you'll be all right. I'll take care of you, sort of.
Right.
I just say it's sort of something just like I don't like doing it. But it's like if I'm doing a new exercise or something, But I don't. That's not really my thing. I don't really get into the sciencey sort of stuff, but it's not something that's really interesting me,
But no, that's okay.
Love it. So
personally, I love the sciencey stuff.
I know, and that's the thing. It all comes down to bias. It's all what your brain is going to respond well to, right? And so it doesn't matter if it's your thing or not. You're finding the things that are going to connect with you, right?
Come on, Barb. Tell us all about this science stuff. Educate.
So, sorry, Barb, did you have a thought there before I move on?
No.
Okay.
No thought.
Okay.
You're not into it. You're not into science stuff either, Barb.
Oh, she is.
No, I do love the sciencey stuff, but Deana explains it much better than I do.
Well, we work well together. So we did promise our listeners that we were going to touch on some of the words that can really bring about some of the emotions. And I'm going to let Barb go first on this one.
Oh, dear.
We got time.
See, I've kind of put a lot of those words out of my head now.
Okay.
I'm not as sensitive to them as I once was.
Right.
Recovery is, this is coming from people I work with. So recovery is one. I will never recover. No, but recovery looks different in very different situations. And I have equated it to recovery in the terms of an alcoholic or an addict. They are always in recovery.
Right.
And I believe someone who suffers from chronic pain is always in recovery as well. But when you say, well, recovery to someone suffering in pain, they're going to go,
yeah.
Mindfulness. I hate that word.
Yeah.
To me, I love the process. I hate the word.
Yeah.
When I was a child, my grandmother used mindful as a reprimand. Be mindful, be more mindful. You need to be mindful.
Yeah.
So when I hear that word, I hear my grandmother's voice in my head and go, well, what did I do?
So true.
Pete's turn. Well, I think. Sorry.
Sure. Pete, do you have any hot button words?
Yeah, I don't know. I'd say, like I said earlier on, I hate being called a patient.
Yeah.
So there's that. I think I think Barb said it earlier. I'm not sure who said it, but you know, when the doctors told me to contact you, to contact me, you know, but I've got to sort out their stuff, like, you know.
Yeah.
And because the doctor's given up, sort of thing, like, you know, and I was thinking, well, what am I going to do? You know, I'm going to sort of sprinkle with dust over them and whatnot, you know. And I think you know, there's like what patients are called, like frequent flyers, revolving door patients, you know. Well, why, you know, we've only become like that because of their system.
All right.
Seekers. And about we're empowering the patient. Mate, we're re-empowering the patient or the person, because we were before we were empowered from the first. Some said, you know, Bob said from the get go, like, you know, but because we hit your system.
Yeah.
I mean, I'm so lucky that I work in self-management because it keeps me, you know, just when I got diagnosed with the prostate cancer back in 2016, I've got to be honest with you, it was such an appalling connection with the hospital. I always remember I was walking back to the station to get my train back home, and I thought to myself, I don't think I'm going to see Christmas with this lot. But I just couldn't. You know, it was all over the shop, and they couldn't even on the first appointment. They couldn't send me to the right room, like, and I would have right to, you know, to see the urologist. And do you know what? When I said that to myself, you know, I don't think I'll be seeing Christmas. You know, the first thing I thought about, I better get a bigger TV then.
Oh, really?
Yeah, I thought, well, I might as well, you know, whatever, because I only had like a small TV, you know. When I bought a 32-inch TV, I think.
Wow.
But I'm very good, and lucky that I know people in the health game as well. And I always remember Sam Ahmedzi said to me, I was having a Skype call with him one night, and I was telling him all the crap that's going on. You know, I'm being bounced around here, there, and everywhere. And he said to me, pulled me up, he did. He said to me, Pete, how do you manage your pain? I said, well, you know how I manage my pain. I'm very proactive. Well, why are you being so passive with this lot? I said, Sam, got it. And from then on, mate, I've been in the drive. I see, it was my fault. I took myself out of the driving seat and allowed them to put me in the passenger seat, out of the driving seat, put in the passenger seat. Yeah. But since then, now, you know, when I've got another telephone call with the oncologist tomorrow, Friday week, like, you know, see how I'm doing and whatnot, my PSA levels and whatnot. So, but it's from the get go, I'm on the front foot. Hello, doctor, how are you today?
Yeah.
And you know, rather than being, hello, doctor. Yeah, so what do you do? You know, how am I? You know,
right.
Being in control, like, you know, and that's why I've got my edge tuned up, like, you know. So, but I behave myself. I eat all the right foods now, and do the exercises and what, you know, all the other stuff.
Right. And you're helping others, which is a big part of.
Keep yourself busy.
Yeah.
But words though, words are so important. Like,
Absolutely.
Yes.
I'll tell you one thing a healthcare professional is really good at. They forget we've never been to medical school.
Yes.
And I say to them, mate, I wasn't sitting beside you in medical school
Right.
because they come out of all the medical language. And I
Right.
go, well, what's that mean? What do you mean by that?
Yeah.
They look at you and saying, as if I should know, sort of thing, like,
Right.
And that happens with I ask a lot of people who make contact with me, and do you understand what's going on? I said no, because they're talking to me in a jargon I don't understand. I said, have you told them to stop talking in a medical? No. See that? Well, because doctor like knows best. Barb says,
Right. It's all Greek to me, right?
hey folks, get back, keep yourself in a driving seat, baby, because that's where you need to be.
That's right.
Exactly. Absolutely.
I think another one that is very defeating, and it's said all the time, is when a doctor or a medical professional says there's nothing more we can do.
Right.
There's nothing we can do to help you with your pain.
Right.
Yeah, there is lots that can be done.
Right.
Maybe you don't know how to do it, but send us to somebody that does.
Right.
Or I find other people in the healthcare world very condescending and judgmental, like pharmacists. I'm currently not taking any pain medication either, but I was. And I dreaded going in to get that prescription refilled because there was always a judgment or a feeling of judgment,
Right.
even if it wasn't spoken out loud.
Mm-hmm.
So, like, pain patients get it all the way around. You get it from friends like, oh, you could do that yesterday, but you can't do it today.
Right.
Or another one that drives me crazy is a doctor will say to you, so where's your pet? What's your pain out of a 1 to 10? Well, do you mean this moment or
Right.
next hour or yet last night? Like, it's very unfair. It's very difficult for a chronic pain patient to give them a number.
Yeah.
That's an acute scale number, not a chronic scale number.
Right. Yeah. Because it's varies
Different ball.
day, different. Yeah, exactly. Different.
Yeah.
Days. Absolutely.
There's lots of words that are just said offhandedly that hit your brain and you go,
Yeah, especially if there's a context to it. Like you said, Barb was a great example around how mindful reminded me of your grandmother yelling at you, right? And I think there's probably a lot of people who have similar stories.
Yeah.
To context.
Yeah. Mm-hmm. Yeah, I told you I hated that word right from day
one.
Yeah.
Well, now I know why.
No, I know any healthcare professionals listening to this thinking, "Oh, I'm a bloody beating us up here," but we're not.
No,
we're just vocalising the frustrations that we've had and what other people have.
Right.
Listen, I've got a lot of healthcare professional buddies, here in Europe and around the world, etc. And I've got, but they're the ones that I work with are the ones that are into. Supporting the person and stuff like that,
Right.
So we're just vocalising not only our experiences, but also the other people that we come into contact with.
Yeah.
And it's about, I don't know, there needs to be a better connection, it's about partnership working, really. And I know a lot of people may think, oh, just give me something and I'll get on with it, there are those sort of people, but there are ones that are struggling. They're the ones that thinking that they can't think yourself, they can take up a bit of time, but really they just need simple stuff. I mean, I know some GPs here, Dr. Tim, Dr. Ollie. I mean, they've learned how to deal with people with pain in a time-based appointment, and they do it really, really well.
Yeah.
And but so it is possible. Yep. It's just that the healthcare professionals find it challenging because they haven't learned it yet.
It's awareness. Absolutely.
They haven't learned the art of how to manage that appointment, that 3 or 4 or 5 minute appointment.
Yeah.
How to get it and move it around. So they start talking about self-management.
Right. And I just did a podcast interview a couple of days ago, and this gentleman was the one leading the research around dignity of care. He focuses on palliative, but there's so much to be learned about the palliative model as far as person-centered care. And all they do is they start off with one question in the start of the appointment to ask about that person. What is it that I need to know about you to help me care for you better? Something as simple as that, right, is really, really important. So
yeah,
I think
palliative care. We could general healthcare workers, if they could only use that same model, that palliative care or something like the palliative community.
That's right.
Boy, mate, we'd have much better outcomes.
Or come and see us. Yes, go ahead, Barb.
And I think there's so few of us. There are so few of us out there that we don't have a big enough group to have the credibility,
right,
to introduce this and what we do.
Right.
AA is a huge organization.
Yes.
That's got a proven track record.
Right.
We have clients with a true proven outcome,
yes,
and ourselves with a proven outcome, but we're not a big enough group to gain that credibility quickly.
Right. And
so what are we going to do about it?
Yeah, absolutely.
I think we need to have a conference.
Yeah.
Well, we do. Have you, my buddy over there in British Columbia, Keith Meldrum.
Yes.
We teamed up. I met Keith in 2018 at the IAS conference down there in Boston, and we've been big buddies ever since. We call each other brother, but we last year, about this time last year, we was, we were pretty. I can't use the word actually. Fed up we were that we didn't go to the IAS conference in where was it it was in Canada on the East Coast. I can't remember where it was. It in
Halifax?
Anyway,
I'm not sure.
I can't remember, but get in there, and there's I know buddy of ours, Joe Belton, she went, and but if you haven't got resources, we ain't going to get there.
Exactly.
So and the thing is, we were invited at the 2018 one. Excuse me, a lot of people with pain, but we wasn't. Excuse me, wasn't that one. So me and Keith, we decided to organise the first international pain self-management conference, which went out in. I can send you the recording of it. It's on YouTube.
Yep.
And then we had some, where funny enough, there's no people from Europe because they didn't want to get up in the morning. So we did it. It was 2 a.m. start here.
Oh.
Yeah, that's but it is what it is, But speakers from Australia, New Zealand,
yes,
Canada, America, and stuff like that. But it was a mixture.
Yeah,
people with pain and healthcare professionals.
Right.
And from that, we, because we teach, during in a conference, in between each speaker, we had a 5-minute pacing break so that anybody watching could get up and move around and whatnot.
Yes. Yeah.
But the communication between each speaker was so fantastic that we started up another thing called Pain Toolkit Conversations.
Yes.
And we did one in May. We did the second one in the other week, and we're doing the next one in December. Excellent. But as again, we've started up a little group, which consists of people in Canada, America, New Zealand, Australia. We were going to conversations. The last one we talked about was meaningful movement.
Yeah.
So we've got some sort of nucleus going on here, but it's where do we want to take that sort of thing? It's where do we this is where we need to keep together, to join up together,
Yeah, absolutely.
Because everything's fragmented at the moment.
I'd like to see a directory, so to speak, of people who do what we do.
Right. Yeah, absolutely.
Honestly, I had never even heard of a pain coach until I met Deana.
Yeah, most people don't know, even if it's not. Regardless of what industry it's in, for a coach, people are like, what does that do, and how is it going to help me with my pain? It's not a pill.
I think it would be great to have the people who focus on self-management.
Yeah.
as a group themselves to discuss how to raise our profile, how to, you know, like those are things we could brainstorm as a group, those of us that do this.
That is true. I like that idea.
Let's do it.
Let's do it.
Okay.
All right. Let's commit. See, we're committing to action.
I'll start if you want. I'll start it up. I'll start up a directory on the Pain Toolkit website if you want, or your one day, Deana. So,
well, we could do both. Yeah, honestly, I mean, whatever information. That's great.
Yeah, let's do that.
Yeah, excellent. Oh, good thinking, guys.
There you go.
So it's over the hour. I'm just trying to be mindful of time. Is there anything else that you want?
Don't say that. Don't say mindful.
Oh, don't say. Oh. That's right.
That's it.
I want to be careful.
Avoid it.
I'm going to bring your grandma back into the conversation. No. Anything else we may? I mean, there's so much more we could talk about. So
let's do another one. How about we do another one?
We'll do it again.
Sounds good.
These are smart. And for any of our listeners who have any recommendations of what they want us to talk about, by all means, let us know. But thank you guys so much for being here, and took us a while to get together, but we're here.
It's been great.
Yeah, thank you.
I've enjoyed it. Thank you very much for inviting me.
Oh my gosh, I'm so glad you guys could be here.
Yes, thank you.
Take care, everyone.